we're at the beginning now of a journey. In Washington, you've got Democrats and you've got Republicans. Well, what if I don't agree with either of them? I want someone in Washington who is not another Washington guy. I shouldn't touch that.
I'm really glad that you can edit this because I can't speak English. Okay, we're at the Marriott in Hebron today. We are here to interview Rand Paul. I'm so excited because I've heard a lot about him, heard a little bit about what he's campaigning for, but I'm really interested in asking him some questions myself. Today's meeting is going to be town hall style. From what I understand, it's going to be mainly geared toward healthcare. I'm really curious to hear about his specific healthcare plan. I hear about a lot of problems, I hear a lot of proposed ideas, but so far I haven't really heard something that makes a lot of sense to me and sounds like a real solution. We're just going to ask you a couple questions.
I'm here to find out what Mr. Paul really believes in and thinks about. I'm very interested in finding a good senator to represent Kentucky, and I'd like to find out if Mr. Paul is that person.
Why are you here supporting Rand Paul?
I'm interested in what he has to say, mostly about healthcare, the healthcare debate going on right now.
First of all, what are your current thoughts on Rand Paul?
I understand he's the son of Ron Paul, whom I admire very much, and I'm looking forward to hearing what he has to say today.
Okay.
Most of the debate we're having now is driven by access. Everybody says these people don't have insurance, how do we give them insurance? That's what the politicians seem to be really excited about and energized by. But when I talk to people on a day-to-day basis, most of them seem to be upset about the expense.
It's hard to argue we have too little government involvement. Government already pays for over 50% of health care. So I would say we already have too much government. But then people say, well, health care's not working. And I say, well, it's because we don't have enough capitalism.
I say in health insurance now, we don't have capitalism. There is no price mobility. Everybody else that's in private business, if you sell cell phones or radios, you make a profit, but the price fluctuates on the market every day and the consumer interacts with the product and competition drives prices down. The problem in healthcare is when you go to your doctor, there is no prices. In fact, I think it's illegal in most states to publish prices of what your doctor charges.
You said your approach is counterintuitive. What did you mean by that?
Well, because I think a lot of people want something to be less expensive and free. So people are used to with healthcare, they want to go in and they don't want a high deductible, they don't want a copay, they just want it all paid for. The problem is if it's all prepaid for in advance, you're paying for it one way or another, you pay for it through high premiums. And so my goal with healthcare is to have much higher deductibles and you pay every time you go to the doctor. And people go, oh no, they're afraid of that, so that's counterintuitive. They think it's not the right way to go.
How do you think you're really going to help people see it this way? How are you going to change that mindset?
We would have to explain to people, you want to pay your doctor when you go in. You want to have open prices, and you want to have true insurance against catastrophic illness. Then insurance would work again. The trade-off would be people say, I don't want a $2,000 deductible, I want a $10 copay. But if you have a $2,000 deductible, your premiums go down. So instead of $800 a month, maybe you're going to pay $800 a year. You could make Medicare last for another 100 years, not by getting rid of Medicare, but by having higher deductibles.
So many politicians are afraid to say anything. They're afraid to say you need higher deductibles to get cheaper health insurance. And because they're afraid to say that because they have to win, they have no other job if they don't win. I've got a good job, I like where I live, and if I don't win, it's not the end of the world for me. It's not like it's a disaster if I don't win. So I think, try to portray the truth, try to portray other solutions that no one's talking about.
To you before the town hall meeting, and you said you were curious to see what Rand had to say. What did you think?
Well, Dr. Paul has a lot of credibility. He seems to be a very genuine person, and I feel very favorably about his positions.
What did you think?
It was very interesting. I'm not going to agree with everybody 100%, but I think I can I can honestly back Mr. Rand for this race.
What do you think about his healthcare approach?
I think that he, being a physician, has a better perspective than a lot of the folks up on Capitol Hill right now.
So do you think Rand Paul is someone you're going to completely get behind?
Absolutely, yes.
Okay. Thank you so much. That was a lot of fun. We got to ask Rand a couple of questions because he got all better. Howdy. I think I know that guy.